I see that Colleen has joined us. Let's see here. Colleen, do you know if Dr. Zwardlinger is going to be joining us on the call today? Okay, I think she's muted. All right, we will go ahead and call our meeting to order at 12:32 p.m. This is a special meeting of the Lake County Board of County Commissioners for us to receive and discuss and potentially take action on a recommendation from our review agencies in regard to special event permitting through the summer. I just want to make sure that we are all clear that there were some issues with our agenda and planner getting out. And so at this meeting today, we will only discuss the special event permit recommendation from the review agencies, and we will not follow this special meeting with a work session. We will convene our Board of Health on Thursday. So that will happen this week. So this meeting, and the intent here is to solely focus on our special event permitting. So with that, I'm going to go ahead and turn it over to our Public Health Director, Colleen Nielsen, so that we can get some information on the current public health orders at the local level and the state level. From there, we will have a conversation with Commissioner Mudge and Janine McGee, who is our Human Services Director, and they will talk us through our recovery process and where we are at in the recovery process, linking those public health orders from the state and local level to the recovery process. And from there, we will move into a conversation of the recommendation from the Lake County review agencies in regards to the summer event permitting process and recommendation. So with that, Colleen, if you would like to go ahead and begin talking us through those orders, and we will entertain questions once Colleen is finished with a basic rundown. And Colleen, if Dr. Lisa is joining us with some data to present, we can have her share her screen or whatever that will work. And then we'll entertain questions around the public health order immediately after, keeping those questions from snowballing too much so that we can continue with the momentum of our meeting. So Colleen?
Yeah, thank you, Kayla. So yes, Dr. Zwardlinger is supposed to jump on with her updated data today. And so she was aware at 12:30, but obviously, you know, she is a provider and she might have gotten called to do something else at the moment. So basically, having been working through this for the last 7 weeks at this point in time, there has been a framework that was developed by CalFO that we've been utilizing, and most public health agencies are utilizing, as well as the governor's office. That shows some of the pieces which you guys have seen that kind of refer to the ski area operations, where for stabilization, we're just coming into the beginner phase, which is a green circle. And then, working our way through, which would be a blue square for intermediate, and expert would be a black diamond. So in order to do that, there have to be 5 criteria that are met. And actually, I'm going to pull them up on my screen so I can see them, and I'm going to slide them so I can read them in my big screen. But basically, and you guys have heard these before, so I know this is repetitive, but I think it kind of just helps once again kind of set where we're at and how we're kind of making decisions. Is for the criteria for us to even move into this beginner space, if you will, of what you've heard me say as well, of like cracking the door, let's take a peek, let's see what's happening, that we have to have a sustained decrease in cases for at least 14 days. Hospitals are safely able to treat patients without resorting to crisis standards of care. Testing can be performed for all people with symptoms consistent with COVID-19. Active monitoring can be accomplished for all COVID-19 cases and their contacts, and clear protocol is in place that requires social distancing and assists with case identification. So as we look at kind of what's been happening in the last week, is We haven't had any new cases, for a week. I know there's been some questions around, say we get a case today, does that mean the clock starts over? It's more of, if we're able to continue doing all these other pieces, we can keep moving forward. We just don't want to spike. That's kind of the thing. If we spike and overwhelm our system, we end up going backwards instead of slowly, very slowly going forward. So with that being said, when you look at those, just getting into that beginner area, if you will, the green circle, currently Governor Polis orders do not allow group gatherings greater than 10. The group size is limited to 10. Our public health order also locally here in Lake County also reflects group size gathering of 10. When you think about stepping through into these different stages, it usually takes about 4 or so weeks to kind of know if we're still doing things effectively. A piece of that is as we start to loosen up some of these restrictions, if you will. For example, on May 1st and through May 4th, we were able to open up most businesses that fall under the personal, like haircut, nails, and a couple others. Just can't think of them offhand, but as well as, offices thinking about opening for 50%. We've been working with all of these businesses in completing a social distancing protocol and getting approval through Lake County to kind of open. And so when I talk about that time frame, we have to realize that infection usually takes, anywhere from, 1 to 14 days for people to become infected. And then it takes them to kind of figure out whether or not are they sick enough to go, and get medical care, and or critical enough that they are getting care and then being transferred down to a larger facility for that kind of advanced treatment. We are encouraging everyone that shows symptoms to get tested because of the fact that all testing is currently free, regardless of who you are, and it's for folks that are symptomatic, so meaning that you do have symptoms consistent with COVID-19. Most of you guys know them: a cough, shortness of breath, and then we have found there's some others like a sore throat, headache, some things that you may not have heard from the beginning, loss of taste, loss of smell, those things. It's important that you get tested because then that kind of keeps us rolling in the sense of protecting if there truly is somebody with an infection, that we have the ability to contact trace and limit additional exposure. So as we think about that, that takes us, anywhere from 4 to 8 weeks to kind of work through that phase, still with group sizes of 10. And if we're feeling confident that we can kind of open up a little bit more, then maybe there's an opportunity for groups larger, which at this point in time, like I said, there's 3 phases. The first one is beginner for groups of 10. The second one would be intermediate with groups of up to 50. And then for us to truly get into that expert range, that means that everything's been going well, 8 to 12 weeks. When you think about that time span, that's kind of our summer, right? In our 8 to 12 weeks, in the sense of, hey, we finally got some weather, we call it summer, and then, winter's back, if you will. And even if we got to that, that's still sorry, I apologize. I dropped off, but I'm back on. Can you guys still hear me?
Yes, we can hear you. Go ahead, Colleen.
Okay, great. It kind of froze. I wanted to make sure. Okay, nope, it's all good. I don't know. I'm at the office today, so. But my point that I was finishing with was, even if we did everything well over the next, 4 to 8 weeks, possibly 12 weeks, and we actually get to where we can have group sizes of, 250 for our special events. There isn't any special events, permitting piece that we have a group size, less than that in some of our, big events and where we're at. And even at this point, as you know, we did cancel all events for May and June. So we're talking about July and August at this point in time. And so with that, recognizing that it's going to take us a while to get into, an expert phase, if we are doing everything right, and if we are not doing everything right, or something changes, or, there's so many different factors that affect, our decisions, and we're constantly reevaluating them. The reality is that to get to 250 people is going to take us months of, stability. Everyone's still social distancing, people wearing, a face covering in public, people accessing, spaces appropriately, in groups of 10 and not overwhelming, a space and those kind of pieces. And that's kind of where I was, able to share that information out with most of the folks, on this call, or repeated amount of times you know, they've heard me talk about this, but that's kind of where we're at and how we kind of presented the same thing of, hey, we are not comfortable, public health, sorry, let me speak for public health. We are not comfortable with gathering group sizes. And at this point we're 10 and we're, you know, we're at May 12th. And so we've got a long way to go. Thank you.
Thanks, Colleen. At this point, if anybody has any questions, can you please use the raise your hand feature in the chat, and I will call on you to ask your questions of Colleen. If you are on the phone, you can hit *9 and that will raise your hand, and I can call on you as well so that your questions can be answered by Colleen. Nobody seems to have anything at this point. Okay, so moving forward, we'll kind of go through this same kind of structure. Please feel free to utilize the chat for some questions. We'll call those out periodically as well. Okay, so moving into our next piece of this meeting, I'd like for Janine McGee, who is our Director of Human Services and our lead for recovery planning, and Commissioner Mudge, who is also sharing that lead with Janine, to walk us through that recovery process, where we're at in the recovery process, and kind of what that looks like going forward. So Janine and Commissioner Mudge, if you will walk us through that, please.
Yeah, Janine, do you mind if I just make a couple other additional points to Colleen's comments? Okay, thank you. And I'm going to attempt to share my screen as well. Let's see, but I would like to kind of talk to everybody about, again, reiterating kind of what public health and the county and city are looking to follow, which is the state's outline and framework. And so here in front of you is a timeline of implementation. Can everybody see that? I actually can't see everybody with sharing my screen, so thank you. Okay. So here's the timeline, and I just want to reiterate that we have been following the state's timeline, as Colleen had said, and so accepting public health, accepting business applications on a new kind of operational structure, meeting social distancing protocol. We've gotten about 40, probably more applications now, and I've approved 36. With a couple pending, and those were numbers as of last week. And so folks that meet that May 1 have been attended to, and then the May 4th on office work at a reduced density. I'd also like to say that there are 3 options to match the state guidelines, which we are doing to enforce more protections. Which perhaps we are looking at some specifics and nuances of what we are requiring folks to meet in protocol, but you can talk to public health to get some more specifics on that. And then there's local flexibility, which as you can see here, is to relax the guidelines further in the event that we know that we are responding and meeting all of our requirements and feel confident in the opening up phasing. Currently having that May 1 and May 4th time frame, we are about, of course, a little over a week into this, and as Colleen said, doing this incrementally and safely takes time to evaluate and monitor. And to be sure that we are meeting expectations and needs or exceeding them. And as you can also see here, any application written needs the authority of all hospitals in the jurisdiction and all elected leadership. Currently, we are not seeking a variance to move at any swifter a pace. And this is the framework that Colleen was talking about as well. And so we are moving into, and I really like this stabilization. I feel like we need to move through a stabilization period to really hit the road running hit the ground running through recovery and a more bolstered recovery period. So this green is right now what we are moving into, being sure that we all can meet these requirements and keep the community safe. I will say that, you know, this is not just the businesses meeting these requirements. This is our community behavior as a whole, and everybody's behavior really has an effect on whether or not we can keep businesses open and the economy opening and running for business. I'd also like to just make mention that following that opening and also the exempt, you know, construction projects that have all, you know, construction has always been exempt, but I'd like to just bring to everyone's attention again the 7 projects that are currently going on in the county and the city that we're discussing having kind of a regular meeting to keep apprised of how we can best capitalize on that and monitoring that even further with the construction workers and that business that may be coming in. So we have the Excel gas line project, we have the city light signal project, the CDOT, I'm sorry, and the CDOT ADA and resurfacing project. The Tabor Opera House will be starting a project into the summer. The airport runway will start when weather and conditions allow. We have West Park Elementary School that's being built, and then the hospital construction that's going on. In addition to that, on June 1, which is kind of our next timeline of a next phase, if you will, the Forest Service will be lifting their order, and Rocky Mountain Rec will be managing and inviting and opening up the campgrounds in the county for visitors. My understanding is that they are not opening group camping, as that really would be hard to enforce and monitor for meeting those social distancing protocols. But remember that we have across the county in Twin Lakes and around Turquoise, we have about 500 campsites. So that could be another, you know, influx and opportunity, and also just something that we need to monitor and be sure that we remain prepared for. And so with that, I will hand it over to Janine, unless there are any questions.
Thanks, Sarah. What I wanted to focus on for you all is the structure of our recovery team. So we will be working on recruiting for our recovery team and bringing on folks who can work collaboratively to get the community back in a place that is as sustainable as possible, recognizing that it's not going to be the same as it was before, but it's going to be a different opportunities. And I think the ability of our community to recover and remain viable will depend on how well we pull together for this process and how well we take advantage of every opportunity that's out there specifically for this. And just to remind folks that while we are feeling an economic impact, this is not the same as an economic downturn. This is a disaster-driven economic impact. And because of that, there is funding and resources available that are not typically available during an economic downturn. So what we have to do is figure out how to capitalize on all of the opportunities that are there right now, particularly for rural communities, and how we can pull together, work with our businesses, identify the needs, and focus on how to get resources in the places that are needed most. We have very successfully worked through the response process and providing financial assistance to families, working with more than 200 families, and we've distributed over $180,000 to folks through a case management model. And that is the model that we would like to continue in working with businesses, sort of digging in and having a dedicated person who can work with each business that identifies their needs, whatever that may be. And it's really varied. It's varied based on, like, every household is varied based on those needs. So what we're doing is inviting folks to think about how they would like to participate in this process. A big piece of this is going to be the economic recovery component. And if folks feel passionate about this, feel they have some interest and want to commit to this collaboration, we would like to invite people to participate in that. Our recovery meetings are going to kick off Thursdays at 3:30. And we will have the chairs of each of those committees start working independently and then come back together to focus on the bigger picture, what our objectives are. And just to point out, we've started the conversation on a regional level just to find out what's going on in other counties and how different regions are either making these decisions and then how they're working together. And the things that we are working through as a community are the same things that Summit, Eagle, Park, Chaffee, all of our neighbors are also working through. So we're not terribly unique in that. We can also pull together in requesting resources because we have been particularly affected as a region, and we have seen some success in that. So we look forward to continuing to build on the economic recovery portion. And early on, our response also included mass care and feeding in particular, as well as financial assistance. So that will also continue. We have a really robust process in our community to meet food needs, and through our local nonprofits, combined with county funding and mutual support systems, we have been able to provide a significant amount of food to our community members. So we hope to continue to build on that and meet that need as long as needed. And if there are questions that folks have or certain concerns about either the response or recovery portion, wanting to know where resources can be found, or see needs that we haven't met or haven't addressed yet, feel free to reach out.
Thanks,
And
Janine.
I'll include my email in the chat.
Janine, when you have these blanks in this recovery document, like chair, co-chair, lead, those kinds of things, when and how will those positions be determined?
So we will presenting to City Council tonight. Is my goal that between today and tonight and a few conversations I'll be having with folks in the community, that we have those positions filled. And again, it could be somebody who feels particularly passionate about it, is very interested, has experience particularly around economic recovery or business modeling, and we would like to get those filled in the next couple of days so that we can really jumpstart this process by the end of the week. And I'll include my email again, and people can reach out if they have an interest or they want to nominate somebody else who they think should be involved. So.
Great. Thank you very much. Colleen, do you know if Dr. Zordlinger has joined us with her data and information?
I have not seen her on the call yet, and I will double check to see if she is available. So
Okay.
if you give me another 2 minutes, thanks.
Cool.
Commissioner, can I make another comment that I failed to address or highlight too, that the county facilities as of yesterday are opening. Most of the outdoor facilities are opening with the protocol. So hopefully that'll alleviate some of the issues maybe with not having those facilities open, and offer more opportunities for recreation and folks locally. Another comment to make about that recovery piece is, working with the EDC and the chamber and tourism panel, just some of the statistics that have come back in surveying some businesses makes it clear that there really needs to be that one-on-one kind of case management approach perhaps to the recovery piece, so that we are sure that people understand, their eligibility through this event and under the CARES Act, where they might not be eligible for unemployment, say, as a sole proprietor and an only employee of their business, because they are now. So, if 25% of folks don't know that or are in that find themselves in that circumstance and aren't seeking funding or don't know that, we need to make sure that everybody is educated and taking advantage of the benefits that are available to them.
Thank you for that info. So while we wait for Colleen to see if Dr. Swordlinger is going to join us at this point, does anybody have any questions in regard to the information that has been presented on the state and local public health orders or the recovery documents that have been presented at this point? Are there any questions from anyone right now?
Not to interrupt, but I'm here, Kayla. It's Lisa. Sorry about that.
Hi, Lisa. Perfect. So we went through at the very beginning a little bit of the state and local public health orders. So I don't know if you had any information that you wanted to present with Colleen with those public health orders or data that you felt was relevant for us to hear in regards to this conversation around the recommendation from the review agencies on special events.
So I do, and I was hopeful that I can share the slide presentation that I had for today. Do you want me to just share my screen that way? Or I think I forwarded it on to everybody this morning as well. Do y'all just want to follow along?
Sarah, if you can have, I think you're the host, you or Ami, if you can have her share her screen, that way everybody that's on can see that. I think that'd be really beneficial.
I apologize, I was muted. I don't have the slides or the information that Dr. Zwirlinger is talking about sharing at the ready, but she can share her screen if possible.
Yeah,
Yeah, I think
just a
that'd be
quick
great.
second to get it in the right place.
Okay.
Sorry, I always wish that I had better technology skills, but I don't. I guess it just is what it is.
Not a problem.
All right, can you all see that?
Not yet. I can't anyway.
Oh, here it is. I'm sorry. I need to share my screen. How about that?
Yep.
Okay. Alrighty, I'd hope to be able to do kind of the same format every week where I compare the state data to the local data so that we all have a frame of reference. And so the slides will look similar every week. They'll just be updated weekly with our new information. So this is the slide that looks at emergency room visits, and the blue line is influenza, the red line is COVID, and the state has put together these little demarcations here that you can see about the first case, restriction of visitors to long-term care facilities, social distancing, reduction of in-person workforce, and then you can see the stay at home. And it is just, it continues to be so vital for us to recognize that we had this enormous spike spike of cases. And then we did the stay-at-home order, and then all of that reduction in total number of ER visits certainly decreased. And what's also very interesting is now 2 weeks into our safer at home order, you can see that the visits to the emergency room continue to decline. So, you know, good job, Colorado, for abiding by the social distancing parameters, because it's clearly working. This is the Colorado data that looks at daily caseload, and the spike that you see here, April 26th, is just when we started doing the antibody testing, when it became widely available in Colorado. So that's why you see that spike. And then we had this lovely decline. And then during the past, you know, a week or so, with the safer at home, there has been an uptick in cases identified. So, you know, as we expected, that, you know, when people start mingling about, that there will be more exposure and more cases, but, you know, very manageable. This, you know, 400 to 500 new cases per day is something that is very tolerable. And again, if you look at the cumulative cases, there is a slight increase over the past 2 weeks over the safer at home. But again, it's, you know, it's not nearly the velocity of increase that we saw in April. As you can see, the slope of the curve is much different. And then this one is what's most important to hospitals. If you look at the flattening of the curve, which is, you know, what everybody talks about, but there it is, where we have this, you know, this enormous slope of the curve in April, as people were getting very sick and needed to be admitted to the hospital. And then as we did the stay at home, people, you know, became sick, but at a much lower rate. And there is, again, a slight increase in hospitalizations based on, you know, the safer at home, but it is very, very manageable. And so what we're doing by following the governor's orders on the safer at home is really working. You know, 3,500 hospitalizations in Colorado per day, knowing that we have about 5,000 to 6,000 acute care beds in the state of Colorado is very, very manageable and definitely will not overwhelm our healthcare system. This is the scary graph of deaths in Colorado, and again, there was that peak in April as we experienced, you know, 30 to 35 deaths per day for a week or so, but we enjoyed this lovely decline in deaths in Colorado as we followed the stay-at-home order, and there has really not been a significant increase in the deaths if you look at what's happening at safer at home. So, you know, again, it's just really kudos to how Colorado's doing. If you look at Lake County's data, we are also doing very, very well at mitigating our infections. And so we also had that peak of infections. And this is both the PCR and the antibody test, which now we're kind of using the same when we're looking at, you know, evidence of infection. And we had that same peak in April where we had, you know, 5 cases per day for that one day, April 22nd. But then we've enjoyed this decline in cases as we followed, you know, our social distancing and really made, you know, care to follow those guidelines. If you look here, this is that positive curve, and again, it is still the same upward slope. So, you know, I put this one in here to let people know that, you know, our cases are still increasing, and unfortunately, I think that they will continue to increase, but it is much less of a rate than it was. And for those who are interested in the difference between the PCR test, which is that nasal genetic swab, and the IgG, which is the blood test, the blood test is orange, the nasal swab is blue. We have not had a positive acute case, so someone who is sick with COVID now in the past 12 days. So it's been great. You know, what Lake County's doing an amazing job. So to summarize just those two slides, if you want to look at total numbers with me, as of the 9th of May, and remember the previous update was the 2nd of May, we've tested 74 patients, and our rate has decreased from 17% to 12%. So we're seeing less acute infections with COVID-19 over the past 2 weeks, or over the past week. And then if you look at the antibody data, also a decrease. And so, you know, about 3%, it was 3.5%, 3.6%, something like that last week. But again, we're showing a decrease in people who are exposed, people who are infected, and people who are showing evidence of illness. And then our little hospital data, we had, and these are very small numbers, you can see it's, you know, 2 patients. But in March, we did have 2 patients who were hospitalized at the same time for 3 days at St. Vincent's. And then we had a little smattering in the middle of April when we had that uptick of sick people. And then we haven't had any other hospitalizations recently, you know, certainly since the end of April. With COVID. So our hospital system is not overwhelmed. And then the great slide here is that, you know, Lake County has had no reported deaths due to COVID-19, which obviously we hope to continue, you know, in perpetuity. So the summary of the slide here is, you know, again, just kudos to us for really doing a great job in keeping ourselves apart. You know, all of the guidelines of staying 6 feet apart if you're home, or if you're sick, please stay home. Wearing a face covering when you're out in public, and then, you know, protecting our frail and people who are at higher risk it's working. And that, you know, the flattening of the curve just shows us that we're doing a great job. As we continue to loosen our restrictions, though, you know, we have to expect that there will be an increase in cases, and you know, we just have to know that, and the curve is not going to be flat forever as we loosen things up. And I think we have to, you know, I mean, obviously we can't stay in our houses for the next 3 years. We have to go out and venture. But what I really want to caution everyone, and I keep saying that over and over again, is that we will not have herd immunity for years for this thing. And it really will speak to opening our community very, very slowly so that we do not overwhelm our medical system. And so, you know, just a kind of a little gruesome scenario is, you know, you think about working in the emergency room here in Leadville and what our capacity is, and, you know, we get a very sick patient who needs to be stabilized and intubated and, you know, flown out to a facility. It's a good 4 to 6 hour turnaround. And so if we get one really sick patient every 6 hours, we can do that. And we can take care of that volume. But, you know, if we get 2 sick patients at the same time, it's very difficult for us to keep up with that. And if we get 3 very sick patients at the same time, then unfortunately that 3rd patient is not likely going to do well because we just don't have the staff or the equipment to take care of them. And, you know, and that's obviously assuming that Denver's still open, and that Denver has room in their hospitals to be able to take that. You know, there are some ICUs around us, you know, in Dale, in Salida, Heart of the Rockies, but they also have limited capacity. They also have their populations that they need to take care of. And I just, you know, I want us to all remember that, you know, what we want to avoid is getting too many sick people too quickly. All right, that's a bunch of information. I speak really fast, but I want to respect everybody's time and just make sure that I don't go over. So questions about that?
Does anybody have any questions for Dr. Zwerdlinger at this point? If you do, please raise your hand and we can call on you to ask those questions of her. If you're on the phone, please hit *9 to raise your hand or unmute yourself to ask your question of her at this point. Okay. Okay, I don't see anybody that would have any questions then at this point, so we will move on from that background information and move into our next topic, which is the recommendation from the review agency to the Board of County Commissioners in regards to special event permits for the summer of 2020.
Kayla, this
yes?
is Commissioner Mudge. I do see a hand raised.
Okay.
It looks like a phone number 540 ending in 6670.
Sorry, I'll come back then.
Perfect.
I'm gonna unmute that number. Caller at 6670, do you have a question?
Hi, this is Gary Campbell, CEO at St. Vincent Hospital. And I just want to close statements. One, thank you, Dr. Swirlinger. Great job with the data. And you're right, this county, our organization, as well as others, health department, everyone's done a really great job of flattening the curve for sure. But I want to make it known that our hospital has not experienced anything in the way of a surge. So we have capacity. We have had capacity all along. Denver hospitals continue to have plenty of capacity. The opinion of a lot of the folks I work with at the hospital has been the surge never happened, and thank God it didn't. But at the same time, at some point, we do need to start opening our county, and we need to start being concerned about the economics of Lake County and Leadville. And I've expressed my opinion via an email today to the county commissioners and have talked to Mayor Lobby. So I just wanted to go on record as saying that, not everyone feels we should stay closed for business until after June. Thank you so much.
Thank you, Mr. Campbell. We do appreciate your comments, and thank you for joining us today.
Personal.
Thank you.
So with that, is there any other questions or comments? Commissioner Mudge, do you see anybody that has their hand up at this point?
Kayla, this is Greg. I had raised my hand. I have a brief question for Dr. Zwerdlinger, if I may.
Sure.
It's really interesting because the last 2 months we've all become armchair experts on coronavirus. But my question is this. I haven't heard a lot of conversation around coronavirus, this particular COVID-19, following what we'll call normal virus behavior in the summertime. What is your feeling about whether or not this virus will go dormant or not, as most viruses do?
It's a great question, sir. So a lot of it we don't know. Obviously, it's not been around long enough for us to be able to tell that. What we're seeing is that as people are able to socially distance better because it's warmer outside, so you're spending more time outside than you are inside. Your windows are open, so there's more air exchange, through the buildings that are here, that the infection rate has decreased. And again, looking at, what we've done with our numbers, we've seen that. We've definitely seen a decrease in infections, which is great. And so, my purpose is to just, make sure we continue to follow that and we continue to open our economy slowly but carefully. And as long as our numbers stay as suppressed as they are, then we have the data to support continuing to do that.
Thank you. Good question. Is that all the questions that you have, Mayor Labbe?
Yes.
Okay, wonderful. Does anybody else have any questions at this point for Colleen, Janine, Commissioner Mudge, and Dr. Zwerdlinger about the information that they've conveyed this far? Sarah, do you see anybody on your end that is raising their hand?
I see Sarah Dallas. We'll unmute her. Go ahead, Sarah.
Hi, yes, thanks. I am just wanting to reiterate the first slides that we saw. We are scheduled to be reopening in the stabilization phase right now and have been under the safer at home orders. Is that correct?
Correct.
So we're not just closed, we're in the process of reopening on that schedule that we're told from the governor and through our Lake County Public Health, and have been actively doing that. There, you already said there was, what was the number of businesses already submitted?
As of last week, well, 40 had submitted and I think 36 have been approved and 4 pending.
So I guess I just want to clarify and understand, because I think there is some questions and feedback that sounds almost like the county is not in the phase of reopening, but we are in the phase of reopening.
Yeah, no, the data that I presented did show the last 2 weeks of the safer at home. Actually, it's like 10 days, but we're doing great. We haven't had any of the PCR RNA tests come back, so there haven't been any acute infections during that time. And it does take 5 to 10 days after exposure, 5 to 14 days after exposure to be able to get sick. But we're doing great, and so even as we moved into the safer at home. The infection rate did not increase. There's a little uptick, but it did not increase, exponentially. And I would recommend that we continue to do what we're doing and continue to slowly reopen things, because the data certainly supports that.
Thank you for that clarification.
Thank you, Sarah. I appreciate that. Anybody else with any questions so far?
Yep, I see Josh Adamson has his hand up.
Sure.
Yeah, I just had a quick one for Colleen. With that safer at home moving into each phase, it said like 2 to 4 weeks, 4 to 6, or 4 to 8 weeks, and then 8 to 16 weeks. Is that one chunk of time, or is that once we get to that next phase, it's 8 to 16 more weeks beyond that point? Is my question. So are we looking at the Black Diamond phase? Is that like late fall, or is that the end of the summer, which is 16 weeks, 4 months? Is that just one chunk of time? We're looking at about 4 months for this to kind of open, or is this looking 6 to 7 months?
Right, and I think, the way it is in that document, it's from the initial opening. So from what we've been doing from kind of May 1st forward, but knowing that some of these stages might be slower or some might be faster. And some of them we might go backwards depending on the data we have. So even if you were to go from if you want to take May 1st, as that date that we started opening up some businesses, moving forward, when it talks about the reason we have those, and I have my other screen, hence what I'm looking at, that, hey, we might be doing it well, so it might only take us 4 weeks to work through that, but the reality is that it might take longer. And so that's kind of where we're at.
Thanks, Josh. Good question. Sarah, do you have anybody else on your end that has their hand up at this point? No? Okay.
I don't see anybody else. Nope.
Okay. So with that, we'll move into the next phase of this meeting, which is the recommendation from the review agencies. I've asked Ann Schneider, our senior planner in building and land use, to present that recommendation to us from those review agencies and walk us through that process. So Ann, if you'll take that on, please.
Thank you, Kayla. As Kayla said, I would like to begin with outlining the process. So when special event application comes in, the clearinghouse for facilitation of that information is building and land use. And on every application that comes through, we send it out to the special event review agencies. And for us as the county, those are identified as search and rescue, the sheriff's office, the EOC, St. Vincent's, Public Works, St. Vincent's Ambulance Service, Public Works, Recreation, Public Health and Environment, Leadville Lake County Fire Rescue, and the Clerk and Recorder. So those are the agencies internally that do the review. If it's an overlapping event, that is also within the city, although the city and county do individual permitting of special events, we do send it out to the city for a situational awareness as well. So the recommendation is coming forward from that collective group after having a very robust conversation with all of the data that has been shared thus far. We bring these recommendations to the board for any events that are in size of 500 and greater. In this pandemic time, we consider any large events that we should be bringing them to the board for consideration. And so it is the finding and recommendation of that inclusive group that they feel as though we are not in a position to support the fall and summer events. Largely that decision was because the group felt that there was no contingency plan that had been submitted that could ensure the safety of the participants and the general public in hosting and supporting those. Also that while the event planners could potentially really help promote safeguards for their participants, there was also the athlete support systems, the spectators, there's the peripheral support of special events that the review agencies felt would fall on those agencies to help support. And there was a feeling that during pandemic vulnerability, our community, our responders may already feel overwhelmed in the community need. And so there was a feeling that we would be putting that stability at risk. And so their recommendation to the board is that they feel that we're not in a position to be able to support the fall or summer and fall special events that are still pending. I also want to mention that over half of the special events have voluntarily chosen to withdraw their applications, asking to us to hold them until next year. They felt that they could not provide us with contingency plans that would be supportive of maintaining the safety of the event or our community. And so largely, many of these events have voluntarily canceled their events. So we do have some remaining events. Also, the overwhelming message from all of the special event applicants have been that they are looking for other ways to support our community. I don't want to be too premature, or I don't really have a lot of information on this, but in a discussion with Lifetime, they are exploring options to help alleviate or aid in economic recovery benefits with maybe some creative virtual opportunities. Overwhelmingly, the message that we have been receiving is that the special events want to find ways to support our community, both in health and safety as well as economic relief. So I think that that's a really positive message that I want to make sure that we share while we're bringing this recommendation forward. I don't have specific information on that yet, but I think it's still being formulated, and I think it's worth mentioning that for sure. And so that's the recommendation that we've been given and we've provided to the board.
All right, thank you, Anne. I appreciate that. Commissioner Glenn, Commissioner Mudge, do you have questions for Anne in regards to the recommendation that has been brought to the board?
I don't have any further questions. I think Anne did a great job of kind of summarizing, the considerations and the concern of existing capacity through the COVID event, and then following state, the state numbers of, if we're in the black diamond and hitting expert level, we're potentially looking at events of 250 people, and we have to consider participants, volunteers used to run the events, family members and crew members. And, I also think that something we have been aiming to improve upon, and that's been requested of the city and county, is to make decisions quickly and sooner and outline kind of a vision for what the summer or the months ahead look like, so that people can at least plan within that framework. And I would be in favor of making a decision now for some of those large events. As like Ann said, I don't think we saw anything that came in with participant levels under 250 participants, let alone, again, all of those kind of ancillary visitors that come with hosting the event. I also will say Breck Epic officially canceled today, which is a great comparison to the Lifetime, the race series and what they do, and Trans Rockies Run officially canceled. So there are, you know, across the industry, these decisions are being made by event coordinators for much of the same considerations.
Commissioner Glenn?
I have nothing.
I do wonder if, sorry, Commissioner Marcella, do you have questions or comments?
Not right now. I will have some questions shortly, but you can go ahead.
Okay. Another consideration, I mean, back to kind of the numbers of the volunteers and whatnot, you know, depending on what may or may not happen, I would be curious to see, you know, what assurance that events have to maintain the dedicated volunteers to put on an event like that. And we know that, again, it's a great resource strain, if you will, on local resources, though we are happy, you know, and love hosting the events. But on top of the current event, it's maybe pushes us a little too thin. I would be curious, and I know, I think maybe we have to be careful. I know the recommendation specifically messages, and the language in there is to the pending permits that have been submitted. So we're talking about, you know, those big applications that are in right now. And I want to be sure to, because I don't think that the consensus is necessarily closing off any, you know, creative or new, smaller virtual events or local economic boosting kind of efforts that may occur. So I wonder if Colleen has thought any more about that, and or how we might, I guess actually specifically, let's just all, you know, keep in mind that we're talking about those applications and not necessarily other activity or events through the summer.
Thanks, Commissioner Mudge. Colleen, are you still here?
Yes, I keep getting dropped. I don't know what's happening with the internet. I'm here at my office, but it doesn't seem to be. I keep feeding in and out. So I apologize. I didn't really hear what the question is.
I don't think Sarah had a question at this point. Just kind of talking through, you know, have we had any conversation around local economic boosters or events or anything like that in regards to the safer at home orders right now?
I'm sorry, Kayla, I only caught part of that. Am I coming in garbled as well?
A little bit. So Sarah was just asking about local events and local economic boosters, if there's been any conversation around that with public health orders. You might have lost her.
At this point in time, we have not sought out anything in the sense of, I think I have the gist of the question in the sense of right now, you know, we're just trying to move forward with the information we have and not necessarily planning any events locally that might fall into those parameters as we move through them. Is that the answer? Am I following the right trail? I apologize.
I think so. And I think really, you know, talking through that now, you know, that will go into that recovery team's economic work when they get to that point. I think for myself, I would really love to hear the clarification from you about the safer at home order and the 250 people. I think that there's some general misconceptions out there that we can apply for a variance to host an event that from the state that will allow us to circumvent that 250 person limit. And so I'm wondering if you can speak to that a little bit.
So right now with the variance process, so currently right now the state is looking at variances for some businesses opening earlier. They are not entertaining increasing group size or looking into that. So some of the variances that are going in, so even if it's, hey, we want to reopen our church, it's still around the 10 person limit. They're not entertaining something bigger at this point. So there isn't an opportunity for a variance. And it should be noted that I would not support a variance for increasing group size at this point in time or for these large events.
Okay. Thank you for that. And so I guess just my final question, there's not any kind of likelihood that the state is going to release the safer at home guidelines to meet that expectation that we can safely hold an event of higher than 250 people within the course of the summer, because that safer at home transition piece that we are going through right now in conjunction with the state pushes that out to the end of August, correct?
I'm not sure I see Colleen on the call anymore.
Dr. Zwerdlinger, do you have any information on that?
Yeah, I wish I could give you more solid recommendations. We just don't know until we see it. We have to follow the numbers. And if the numbers continue to look like this through June and July, then yes, August would be certainly a time where we could actually have more folks come to Leadville, but we're just not going to know until we do it. And these last, 2 weeks have been great. I have no way to predict what's going to happen, over the next period of time. So I wish I could give you that answer, but I just don't have it.
Commissioner Marcel, I have a hand up. Josh, go ahead.
Just following Dr. Lisa's point there, what's the detriment for waiting a little bit to make this decision for later events in the month? I fully understand June's kind of out of the picture, but if we're looking at events in late July, August, we have some time still to get some more data on and make maybe a more informed decision and maybe economically help our county out a little bit if we can. If it comes to it, then we cancel stuff. I understand what Sarah's point about people just want to know. I mean, sometimes it's the best thing is just, okay, it's canceled, let's move on to the next thing. But I just want to know maybe what's the detriment to waiting a month or 40 days or something to make this decision for some later events.
That was for Dr. Zwerdlinger, correct?
I mean, it can be, or it could be for commissioners as well.
Anne, can you maybe tag on to that a little bit with Josh's question about waiting for those events?
Yes, that I would really like to, Kayla. So the event planners and the amount of coordination and situational awareness in order to support events of that size needs preparation time. We require 90 days at a minimum in order for the planning that needs to be done to host the special events along with the event planners. The overwhelming, kind of the push now to make some decisions from those folks is because they need considerable time, especially on a larger event, in order to prepare for those. So overwhelming what we've heard from the event planners is that kind of a wait and then try to to host the events in a window of opportunity, or maybe inundate September with a barrage of special events would be really hard to support. So I think that I completely understand, that thought to kind of wait, but we've had those discussions a bit, and there's just a lot of planning that goes into events in a regular season, but in a season that has the issues this one does, it would be pretty difficult, I think, to kind of do last minute coordination, and it might set everybody up for failure a little bit.
That's excellent. That's, I mean, that was the only reason I posed the question, was just to clarify those points. Thank you. I appreciate it.
Thanks, Josh. I see Colleen has joined us again. Colleen, we were just talking about the 250 number that we and the likelihood of us actually getting to the timing of allowing event of over 250 people and what that looks like, and that not happening probably until the end in working through those safer at home orders. So I was wondering if you had anything to add on to that.
No, I think, that's appropriate in the sense of, if we get to that 250, that's great. That means that, maybe our next increment is, 500, and then our next increment is 1,000 after, 2 months, which puts us through the winter. And so at this point in time, and, and to Ann's point, all the prepping, only to know that that is not something that we're going to get to that line this year, in the sense of having these large scale events. And so, like I said, even if we do everything well, and in 8 to 12 weeks, we feel comfortable with the size of 250, it doesn't speak to any of our current applications that we have for special events.
Not being more readily available.
Commissioner Marcella, I have, I believe the undersheriff has his hand up.
Sure. Undersheriff Friedenberger, if you'd like to go ahead.
Yeah, sorry about that. I was just going to try to comment with what Ms. Schneider said, that as far as getting events planned for September, I don't think we would have the buy-in from our staff for that. That's typically done on a volunteer basis when we provide security for those functions, and I just don't think we would have the staff buy-in to facilitate that.
Thank you. Commissioner Mudge,
yes, I have Emergency Manager Kaylee Ham has her hand raised. Go ahead, Kaylee.
Thanks, Sarah. Can you hear me?
Yes.
Okay, thanks. Yeah, just to chime in on the piece of, the target number we have today is 250 people. From my office's perspective, it is our goal and our mission to implement the mission areas of FEMA, which is prevent, protect, mitigate, respond to, and recover from emergencies or disasters. And in terms of this consideration, I don't think we can adequately or confidently say that we can address all 5 of those mission areas. And that's why we participated in the recommendation with building and land use to make these points that if we can't say with confidence that we can address that, it does not seem appropriate. And it's my department's duty to tell you all that is a big reason why it's not something that we're comfortable with. And that's also with all of the offices and our partners and stakeholders that we work with, conversations with what they're comfortable with, and hearing Undersheriff's point that they wouldn't be comfortable or have that buy-in is really important.
Thank you. Commissioner Mudge, does anybody else have their hand up at this point?
Yes, Michelle Duffy with the race series has her hand up.
Wonderful.
Go ahead, Michelle.
Hi, Michelle here. Just quickly, and not to be decided on this call, but reiterating what Commissioner Mudge dropped into the chat here, that when we think future and into the summer, events outside of those that were permitted, what number we're comfortable with. That will really help guide and steer the different activations that we can think about to impact the local community. So we should keep that at the forefront. Just the quicker that we can get an understanding on what comfortability levels are through July and August, then the quicker we can start to roll something out in the future when people are ready for it. That's it.
Thank you, Michelle. I think that's really important to hear from you and hear from your perspective. And I think, you know, that brings us to a good point to talk about, you know, the race series has a huge impact on our community, and it has done exactly what it was intended to do, which was to supplement our economy in times of economic uncertainty. And for that, I think we are extremely grateful. At least I know I am.
Absolutely.
For that kind of investment into our community and investment into the economy of our community with our partners at Lifetime. I did want to take an opportunity to hear from the city's perspective on this a little bit. So Mayor Labe or Sarah Dallas, if you could give us your perspective, that'd be wonderful.
I find the conversation interesting. You have a pretty good idea how I feel about it, but so we won't belabor that. I would say a couple things. I would say because of the moving, and we're not even there yet, the 250 person limit, that many of these events are self-canceling. So I don't think whether I love the decision or not, I don't think it's that hard a decision to make under the circumstances. I would say we've heard a lot from different agencies that aren't comfortable with capacity. I would say that should not be a factor. We're all servants of our community, and we should do whatever we possibly can to make things happen. But in this case, it would appear that regardless of what the county commissioners decide, the events are going to cancel themselves almost across the board. Is that what you think, Ann?
Greg, yeah, a large amount of them have reached out and said that they are, you know, they would just like to have their applications held for next year. That in surveys that they've conducted with their participants and just in research they've done internally, they've decided it's in the best event of the permit, or excuse me, of the event, to just take a break this year and come back and to our community next year.
And that makes perfect sense because of, just as you suggested, the uncertainty. You know, they have a lot of money to invest. Boom Days was in the same situation. So no, that's good luck. Go forward.
I'd also like to just reiterate too that we're going to have this similar conversation, I believe, tonight with City Council, and get more. Be sure that the message and the education and information is shared with the city and get more perspective there from them.
Correct. You are on the agenda to talk to the collective of the City Council.
Thank you, Sarah and Greg.
Is Dr. Zwerdlinger presenting to City Council this evening as well?
Yes, sir, I am.
Thank you.
All right, thanks. Commissioner Glenn, do you want to present us with any information, add any information, ask any questions of the folks that we have on the line right now?
Well, I think it's very important that the main goal here is to help the local businesses. It's not just about events in the summer. We have business owners. They need their businesses open so they can make money. So that's something I'd like to see us move forward on safely.
Right. Thanks, Commissioner Glenn. And I think, you know, Colleen and Sarah Dallas had raised that point in the beginning of our meeting where, you know, we are moving through that safer at home protocol that has been outlined and given to us by the state, and we cannot be less restrictive than the state at this point. We can only be more restrictive than the state. You know, there are counties that have been able to apply for a variance. It sounds like there have been 24 variances applied for and only 2 have been granted. And so I think, you know, when you look at those counties that have been able to be granted a variance, they were granted a variance because of their capacity. So Eagle County, with their partnership with Vail Health, and the resources that they have with Vail Health, made it very easy for them to apply for and get that variance. And with us being a small rural community and relying on the regional and state partners that we have, I don't know that you know, we have the same opportunity as Eagle County or Summit County, and I don't think it's fair to compare our numbers to their numbers and our capacity to their capacity straight across the board. So we are moving through that safer at home order, and businesses are working to get themselves open and get themselves back to business. And you know, we do understand that there's a huge economic impact that's going to happen with the lack of events that come this summer and the lack of tourism that comes this summer, just in general, from people not wanting to risk their health in traveling. So I think, you know, we have those situations and those circumstances that we have to work through as well with our recovery group. So I don't know that I have anything further at this point for anybody that has been part of that review agency. And I'm sorry, I missed Mayor Labe's questions about the review agency and the city participation. Did the city participate in the review agency work?
I'm sorry, I didn't see the question, but the invitation for discussion was sent out. I do believe the Leadville PD was the only one that was able to attend the last conversation that we had. But the invitation was sent out. We also offered in the event that the date wasn't conducive, to please provide us with comment, and we would lift it up in the discussion, or a proxy to attend to lift up concerns. So we did have the Leadville PD in that discussion with us.
Thank you. Commissioner Mudge, go ahead.
I just want to reiterate, Chief Bertolis was in attendance. And then I see Sarah Dallas's comment stating the fire department may have also been in attendance. And again, I mean, I really don't think this is beating a dead horse. I don't think we can say it enough. As Commissioner Glenn kind of points out, we are, you know, the opening is super important. We are moving through that protocol and that process. And just because we open the doors or hit those benchmarks doesn't mean that there's no looking back. If the community behavior and visitor behavior does not, you know, risks the continuation of the process and progress of reopening, that could be detrimental for all, the businesses especially.
I think that raises kind of a good point too, Sarah. You know, I think about the data that we have at this point and the behavior of the virus that we have at this point, and I don't know that we have enough information to say with certainty that we won't go backwards in the stay-at-home order in the fall. And if we go backwards in that stay-at-home order and these businesses have to close again because we didn't do it right the first time, I think that could be more detrimental to our economic, you know, our economic standing than if we just take our time and move through this right one time. So I don't know if you have anything to add to that, Drs. Wardlinger or Colleen or Commissioner Glenn.
The other piece that we're not remembering is influenza will come back in the fall as well, and that, you know, that's a second whammy that will happen. And yeah, you know, we just don't know. And I think we're doing the right thing. And I think that we're opening up our businesses as we are. You know, I think everyone forgets that I'm a business owner too. And I completely understand the economic impact that this thing has had on me also, which has not been great. So we have to do this very slowly and carefully, and we're doing a great job so far. And I keep, you know, wanting to cheerlead that, that we are doing a good job. And I think that Kayla, you're exactly right, that as long as you continue to do what we're doing at this pace, that we will be open and that we won't have to have a second closing, and that we'll have the reserve left for when influenza comes in the fall as well.
And this is Colleen. I would just like to share kind of what Commissioner Mudge is sharing in the sense of personal behavior, in the fact of is if we have people gathering, you know, privately, you know, in groups greater than 10, and then we have multiple people infected, and you know, and then it kind of changes kind of what we're looking at. Can we maintain that? But if people continue to do those things, the understanding is that that actually affects our ability to keep rolling as a town and a community and continuing to open businesses. So I think that personal responsibility, when folks, when there's some pushback on, you know, hey, I don't have to do that, has to recognize as part of this community and wanting us to all thrive, that we're all in this together, and we all have to take personal responsibility and recognize that your actions truly have impact ripple across the whole community, not just in your own social group, but across the community in general. So I just wanted to put that plug in there as well. Thanks.
Thanks. So Commissioner Mudge, I had seen that you had put in the chat, hold on here, that we need to decide on a target number of participants to set as a goal. Do you want to, can you talk a little bit to that? And Commissioner Glenn, please feel free to jump in with your thoughts on that, for what decision we need to make here today.
My comment was coming kind of after Josh's question about, you know, what's the harm in waiting? And I think more so than I think what I meant to say was really like we are sticking with the state guidelines, and right now it appears, you know, we are sticking with the state guidelines of that 250 number, and it's not going to get above that. And so with that, you know, as was commented and discussed, none of the current permitted events meet that simple criteria. But if, you know, I'm not sure what the best framework is to move forward as far as, you know, being open to any new suggestions of those, you know, virtual opportunities or other creative opportunities. I don't know that we have to outline that specifically right now. I know we have, I don't know if Lifetime has some thoughts, or hosts would have some specific needs, other than maybe us all having a comfort level of saying 250 is the max, and that, you know, maybe even being more specific and defining that, whether or not that means, you know, volunteers or staff for hosting and other participants. I see a hand raised, and I also, Michelle.
Yeah, just to speak to that, and obviously we can tackle it when it's appropriate, but those things that you're mentioning, Sarah, what would be helpful for us? Like, none of our events fall within the guidelines of 250 or less, but if there's an opportunity where we could do more of like a media activation that brought, this is an example, but 12 athletes that raise money for the community, is that acceptable? Who counts within the guidelines? Is it staff, volunteers, and participants? Is it just the participants? Just understanding what the parameters are would be really helpful for us, as we do want to continue an economic impact in some way, and we're just kind of spinning on what would be possible. Again, we don't need to solve it now, but these are the things that we're trying to think about to stay nimble and relevant throughout the summer. Thanks.
Thanks, Michelle. Commissioner Glenn, what are your thoughts?
Well, I think it's a little premature to trying to figure out a number of what size event or what size of gathering you'll allow. I think there's too much information yet to come.
Commissioner Mudge?
I think I appreciate Michelle's comment about not necessarily having to solve that now, and maybe we really just keep the conversation going fluidly between any potential hosts or event holders and the county and all the referral agencies to talk about where we're at and maybe outline some more lenient timeframes in which to propose and turn around any events that might be considered. But I don't know that we'll necessarily get kind of through all those details and hit all those details in this conversation.
Okay. I have a tendency to agree with you. It sounds like you and Commissioner Glenn are somewhat on the same page about that. That it's kind of early to just make that final determination, and that we can go through those motions as we progress through the safer at home phases. Is that kind of what you both are aiming at, Commissioner Glenn and Commissioner Mudge?
I think so.
Yeah.
I think I'd be comfortable right now, just making it clear that we do intend and should kind of plan for that 250 as a ceiling, and nothing more. But I think that's kind of been the consensus of the conversation.
Right. I think that's a smart understanding for us to take at this point, knowing that those are the state guidelines that have been applied, and given the information from Colleen that even if we were to apply for a variance, the state is not accepting a variance for events or even considering them at this time. So I think that's applicable for a ceiling. I don't necessarily know that we need to make a final decision on that today.
Mm-hmm. Right.
Commissioner Glenn, do you have some additional information or anything else to add?
No, I don't.
Okay, Commissioner Mudge? No?
No. I'll take a stab at a motion.
Sure.
Okay. I'll move to accept the recommendation from referral agencies to the Board of County Commissioners to cancel all pending permitted events through, do I need to do a timeline? Permitted events through the summer season of 2020.
Second.
Okay. So we have a motion on the floor that we accept the recommendation by the review agencies to cancel events through the summer season. With that, we have the opportunity for discussion as a board. Commissioner Glenn, do you have anything to add to the discussion at this point?
No, I don't.
Okay. Commissioner Mudge?
No, nothing really specific to the events, just again, highlighting that this is for the existing permits that last, and also to ask everyone to please make it, as we are talking about personal responsibility, I'd ask to, share out the information that you've heard or learned today, and the process and the considerations with folks to help us understand as a community the importance of why we are, making the decisions, and under what detriment kind of neglecting guidelines could be for our community's health, safety, and economy.
Cool. I think I would just kind of, I would kind of like to add on to that maybe we revisit this again at the end of of July, or have a timeline on that motion for through the summertime for those events. And then I think also capping it with the 250 mark right now, pending movement through the Safer at Home public health orders, so that we are solidifying that, for my personal opinion, that we're solidifying that decision to follow the state guidance of an appropriate and safe event process for participants and responders.
Are you asking for amendment to the motion to include following state Safer at Home public health order?
Yeah, I would amend it to add that state Safer at Home guideline, and then for us to revisit, so that I don't know what the events look like going into the winter time, fall and winter time.
So when I say summer events, do you want to say through August or September? And what is our latest dated event? That is.
We have 2 pending in September. We have the Flaming Foliage and the high school cycling event. So those 2 actually fall on the same weekend, and they're mid-September. So I would just ask for direction on how staff should respond to those 2. They're both over 250 in numbers, but they do fall into the September month and are pending.
And I believe Flaming Foliage has canceled their event.
Okay. Well, then I guess we did get a contingency plan from the high school cycling this week. So they would still remain poised and waiting for an answer. Thank you, Mayor Lively. Thank you for that.
So Commissioner Marcel, would amending my motion to include accepting the recommendation of the referral agencies for the board to cancel all currently permitted special events through September because they do not meet the state stay-at-home and protocols of the cap of 250 participants or less?
Yeah.
Does that
Sarah,
mean?
This is Greg, I'm sorry. I would ask that maybe you not do that. And the only reason I say that is the Lake County Community Fund is still planning on a community dinner. Now, we may not be able to hold it. I understand that. And that would be unfortunate. But I have this feeling like we don't know what's going to happen between now and, say, the end of July in terms of what mandates are going to come from the state, because we know that, we're going to be under those health orders, whether from our county health department or the state. It's going to be the same. But that's still something that we have, a planning around. And I would hate to quash it this early in the year. I'm just speaking to that one event.
The motion is addressing the currently permitted events.
I think we're making this way too hard. I think if we're going to revisit this, why do we need a motion to accept the event board, their feelings about it? If we're going to revisit it, let's just make a motion to revisit this in July.
May I comment on that? I would just respectfully say that the events are asking, because of the piece that we kind of talked about earlier, the planning that takes place in order to put these events on, they are asking for a response so that they can put their energies into next year. And so maybe we are just looking at the pending applications that are before us. Perhaps I could suggest that we could send a message to them that if and when we are in a better position, then we could encourage them to reapply, and we can revisit at that time. So maybe we could just focus on the pending applications And certainly if things in the climate is better for special events, direction to, we maintain a database of all of these folks, and we could have great communication with them and let them know that we're in a better position, and we could just make sure that we provide good communication and stay in good communication with the events when we're in a better position to accept applications.
Yeah, I think that kind of tags on to what Sarah Dallas is saying, that, you know, as things change and things progress, and like Michelle was talking about with the race series, they just need to know what kind of event they could potentially put on or what they may or may not be able to do. As things change, could those folks come back to us with a new application of something scaled down that meets within our safer at home order and meets public health's requirement? And what do you think about something like that with that motion, that we that those events can come to you with an application that goes through the public health protocol and current stay-at-home orders issued by the state, or safer-at-home orders that are being executed at the state level?
Absolutely. I think that the high school just sent an amendment in, and so potentially they do have a protocol that we can put back out to the review agencies and we can reconsider. So the recommendation that before us board are the contingency plans, the applications that we've received thus far that don't meet any contingency plan that is acceptable in the eyes of the review agencies for approval. And so absolutely, I think that I think we could still remain open to applying if somebody wants to come in with a creative way in which to proceed, and we can take it on a case-by-case basis. So I think, yes, just a response to the pending applications that don't meet a contingency plan that provide for the current regulations.
Okay, thank you, Anne. So Commissioner Mudge, do you want to reword your motion? I don't have that recorded right now.
Sure. I can, I'll just, let's forget about the motion to amend the original, and I'll rescind the original motion and attempt again here. I make a motion to accept the recommendation of the referral agencies to the Board of Commissioners for pending special events permitted through the summer season that are not meeting the state social distancing protocol of having 250 participants or less.
Second? Oh, sorry, Mark, I didn't mean to cut you off. Okay, so with that, we have a motion on the floor. Commissioner Glenn, do you have anything to add about this new motion? I think it kind of opens us up a little bit to have that give us the ability to reconsider these new applications or these events to kind of tailor those applications to those safer at home orders.
Yeah, I'm fine with that. I think we need to revisit this whole thing in July. We'll have a better idea, and then we can change things again.
Sure, absolutely. Thank you for that, Mark. I think that we can definitely block some time off in July and have a special meeting to follow up with this, maybe the second week in July. On a Tuesday at 1:30, I'll just have Amit send out a calendar invite, and we'll put that on the calendar now so that we can revisit it. Commissioner Mudge, what's any further discussion at this point?
I think no, I think the conversations need to continue with land use, the permitting department, and the referral agencies, and so that we can develop, you know, what the threshold or the triggers may be moving forward in entertaining any other kind of event circumstances.
Cool. All right, wonderful. So with that, is there any further discussion amongst the board at this point? Okay, seeing none, all those in favor? Aye. Okay. So at this time, we've been here for an hour and a half, and I would like to thank you all for taking the opportunity to meet with us today and talk to us through, you know, the thought and consideration that goes into this planning piece. And I just would like to take an opportunity to remind everybody that this is a situation that we are not navigating alone. We are all navigating a similar storm, just in different boats. And so I would like to take the opportunity to really thank our Building and Land Use Department for their hard work in pulling together this meeting with our referral agencies. And thank you, Lifetime Fitness, for being here and being a collaborative partner through this, and for also, you know, being so willing to work to find a way to continue to be a part of our community and our economy. And I just wanted to take an opportunity to remind everybody that, you know, we are doing the very best that we can for the greater good of our community. And that balancing act of, you know, opening and protecting the health of our community and our vulnerable populations is definitely not something that is easy to navigate. And it's definitely something that we take very seriously. And so, you know, I trust and believe in the work that our health department and our medical professionals in our community are doing. And so thank you to my fellow commissioners for their hard work as well around these public health orders, and for us working together collaboratively as a board to be sure that we get through these hard conversations together. So, so thank you very much. And again, you know, our contact information is on our website. Please feel free to share it widely and encourage people to reach out to us if they have questions. It's our job to be sure that we're answering questions and making sure that we're doing what we need to do for our community. So just remember to act with compassion towards one another. You know, we get a lot further when we talk through ideas with kindness and assuming that positive intent is the end goal for all. So with that, if there's no further questions or comments at this point, Commissioner Mudge, do you see anything on your end?
No, thank you for those comments, Commissioner Marcel.
This is the mayor. Can I say something real quick?
Sure.
I thought this was a very thoughtful conversation, consideration, and a very thoughtful motion. Thank you.
Thank you, Mayor.
Thank you. We will continue to work through our recovery process with City Council this evening at 6. The link and the call-in information is on the Commissioner Planner. It's on our Facebook page and our website. If you need a copy of it, please shoot me a text or an email and I will send it to you if you'd like to join us. And with that, we will adjourn our meeting this afternoon at 2:14 p.m. So thank you all for joining us. Yes.
Can we do other business here at this meeting?
I did not
What
have anything.
What I have is I have a repair order on the elevator at the courthouse.
Sure.
And we need to make a decision because it's quite expensive.
Okay. Hey, Mark, would you mind sending that to Commissioner Mudge and I in an email, and I can add it to our agenda on Thursday?
Okay, so we're having a special meeting on Thursday.
Yes, so I sent out a revised planner with a special meeting on Thursday, and we'll convene our Board of Health on Thursday, and I will add that to our agenda on Thursday.
Okay, that's fine. I will do that.
Okay, thank you so much, Mark. I appreciate it.
Okay.
All right, thank you, everyone. Have a wonderful day.
Thank you.
Thank you.